Heat exhaustion is caused by loss of salt and water, usually through excessive sweating. It develops slowly and usually happens to people who aren't used to hot and humid weather. Signs and symptoms of heat exhaustion. Look for a headache, dizziness and confusion, a loss of appetite and feeling sick, sweat and pale, clammy skin, cramp in the arms, leg and stomach, a fast weakening pulse and breathing.
What to do? Help them lie down, out of the sun, and raise their legs. Give them water to drink. Advise them to seek medical advice.
A heart attack happens when the supply of blood in the part of the heart suddenly blocks, usually by a blood clot. You can make a full recovery by following a heart attack precautions, but this may depend on how much of the heart is being affected. Signs and symptoms of a person having a heart attack. Having crushing pain in the center of the chest that may spread to their jaw and down one or both arms. Be breathless or gasping for breath. Be sweating profusely. Experience pain similar to indigestion. Collapse without warning. Have pale skin and their lips may have a blue tinge. Have rapid, weak, and irregular pulse. Have a feeling of impending doom.
911 or 112 for emergency help. Straight away and tell them you think someone is having a heart attack. Help them move the casualty into a position. The position is on the floor with their knees bent and their head and shoulders supported. Give them one aspirin tablet, 300 milligrams, and ask them to chew it slowly. Do not give aspirin to the casualty if they are under 16 or they are allergic to it. 4. Ask them, the casualty, to take their own angina medication if they have some. 5. Keep monitoring the casualty level of response until emergency help arrives.
Food poisoning can be caused by eating contaminated food. In most cases, the food hasn't been cooked properly and it is contaminated by bacteria such as Salmonella or E. coli. Signs and symptoms for food poisoning: vomiting, stomach cramps, diarrhea, sign of a fever, and with high temperature.
What to do? Advise them to rest and drink water or oral hydration solution. Seek medical advice if worried.
Hypoglycemia. This is where the blood sugar level is lower than normal. It can be caused by the imbalance between the level of insulin and the level of glucose in the blood. Someone with diabetes may recognize the onset of hypoglycemic episode. Signs and symptoms to look for in hypoglycemia: weakness, faintness or hunger, confusion and irrational behavior, sweating with cold, clammy skin, rapid pulse, palpitation, trembling or shaking, deteriorating level of response, medical warning, jewelry or medication.
What to do? Sit them down. Give 3 chili babies 150 ml fruit juice. No improvement. Call 999.
Fainting is when someone briefly becomes unresponsive because there is not enough blood flowing to the brain. People often faint as a reflection to pain, exhaustion, hunger, or emotional stress. When someone faints, their pulse will slowly down but usually picks up and returns to normal soon afterwards. If someone who faints and continues to be unresponsive after a few minutes, then this could be more serious. Signs and symptoms to look for. A brief period of unresponsiveness, often causing them to fall to the ground. Slow pulse, pale, cold skin, and sweating.
What to do? Ask them to lie down. Check for other injuries. They may have hurt themselves falling down. So look for head injuries and any other wounds. Treat as appropriate. Kneel down next to them and raise their legs, supporting their ankles on your shoulders to help blood flow back to the brain. Make sure that they have plenty of fresh air. Ask other people to move away. And if you're inside then, ask someone to open a window. Reassure the casualty and help them to sit up slowly. If they begin, call 911 for emergency help.